This short film will provide information about your warfarin treatment, how to take it, how it is monitored, and any precautions you need to be aware of. You will have been given an information pack about warfarin which you should read as well as watching this film. The pack will also contain an alert card and record book. You can show your alert card to any healthcare professional, such as your doctor and nurse, but also your pharmacist, dentist or podiatrist, as they will need to know that you're taking warfarin. Always carry your alert card with you, perhaps in your wallet or your purse, just in case somebody needs to see it in an emergency. Warfarin is an anticoagulant medicine. This means that warfarin reduces the risk of developing blood clots by increasing the time it takes your blood to clot. There are a variety of reasons why people are prescribed warfarin. It could be due to an irregular heartbeat or to prevent a stroke. Your doctor, nurse or staff at your warfarin clinic can explain why you're taking warfarin. You should take your warfarin once a day at the same time every day. Most people take it in the evening around 6 p.m. If you forget to take your warfarin but remember before midnight, you should take the dose. If you remember after midnight, you should not take that dose. Take your normal dose the next day at the usual time. If you normally take warfarin in the morning but forget to take it, you can still take it if it's less than 6 hours late. If you're more than 6 hours late, then do not take that dose. Take your normal dose the next day at the usual time. Never double your dose or take 2 doses on the same day. If you do miss a dose, make a note in your warfarin record book. There are different strengths of warfarin tablets available. 0.5mg tablets are always white. These tablets might also be called 500 micrograms. 1mg tablets are always brown, 3mg tablets are always blue, and 5mg tablets are always pink. Most people who take warfarin take a combination of 1 and 3mg tablets. It is important not to mix up the number of milligrams with the number of tablets that you've been told to take. If you find the instructions given to you are unclear, speak to your pharmacist or ask your anticoagulant clinic. It is very important that you always take the correct dose of warfarin. If you have any questions about your warfarin dose, always ask your doctor, nurse or pharmacist. Make sure you always have a supply of warfarin tablets and ask for a repeat prescription in plenty of time. Most doctor's surgeries take a minimum of 2 working days to process prescription requests, and this will not include weekends and holidays. Many things can affect warfarin, and you will need to have regular blood tests to check how long it takes for your blood to clot. The blood test is called an INR test, which stands for International Normalised Ratio. The blood test will usually be done by a finger prick test, or you will be asked to give a blood sample. Most patients have a target INR number of between 2 and 3. A small number of patients may need a higher INR number. Your doctor, nurse or pharmacist in your clinic will adjust your warfarin dose according to your INR result. If your INR number is too high, your blood will not clot quickly enough, and your warfarin dose will be reduced. Otherwise, you'll be prone to bleeding or bruising. If your INR number is too low, your blood will clot too quickly and your warfarin dose will need to be increased. Your new warfarin dose will be written in your record book, or some clinics will provide a printout of your doses for you. Warfarin is commonly said to thin the blood. This means it will take longer for your blood to clot, so you may experience more bruising. If you cut yourself, it may take longer for the bleeding to stop, and you might need to apply pressure with a clean dressing. Seek medical advice if you have any of the following warning signs: nosebleeds lasting longer than 10 minutes, blood in your vomit, blood when you cough, blood in your urine or stools, black stools, unusual bruising, unusual headaches, for women heavy or increased bleeding during periods, bruises that appear if you haven't hurt yourself. These warning signs might mean that your INR number is too high. If you experience any of the warning signs and it's during working hours, contact your warfarin clinic or wherever you get your INR tested for advice. If you need advice outside of normal working hours, you can call NHS 24 on 111. If you're involved in an accident, can't stop bleeding, or have a significant blow to the head, you must seek urgent medical advice at your nearest accident and emergency. Sometimes warfarin may cause nausea, diarrhea or a rash. Speak to someone at your warfarin clinic if any of these symptoms occur. You can still go to the dentist as usual. You should tell your dentist before your appointment that you are taking warfarin. If you need dental treatment, your dentist will tell you what to do, and whether you need an extra INR test before any planned procedures take place. Other medicines and herbal remedies can affect how your warfarin works. Any medicines that you are already taking will be considered by your doctor when starting on warfarin. Tell your doctor, nurse or pharmacist at your warfarin clinic if you're prescribed any new medicines or if you stop taking any of your medicines. Any new medicine might affect the warfarin and you may be asked to take an additional INR test. If you're prescribed any course of antibiotics, you should have an additional INR test. If you buy any medicines over the counter, check with your pharmacist that they're suitable with your warfarin tablets. You should avoid taking aspirin or ibuprofen unless advised by your doctor. Even short episodes of minor illness such as the common cold or diarrhea and vomiting can affect your INR results, so your warfarin clinic will need to know about this. You should record the dates of any illness in your record book. If you suffer from any minor illnesses, you should keep well hydrated by drinking enough water and seek advice from your community pharmacist or warfarin clinic. Remember, if you're taken into hospital for any reason, take a list of the current medicines you're taking and your warfarin record book. Sometimes your diet can affect how warfarin works. Foods containing vitamin K, such as green vegetables, can affect your INR result. Rather than leaving these foods out of your diet, make sure you enjoy a similar amount on a regular basis. You can continue to follow a normal diet pattern, but try to avoid any major dietary changes. And avoid cranberry juice, as this can alter your INR number. If your diet does change significantly, make a note in your warfarin record book and let your warfarin clinic know. Remember, if you have any questions about your diet, you can ask for advice in your next appointment at your warfarin clinic. Alcohol can also affect how warfarin works. You should not drink more than 1 to 2 units of alcohol per day. Avoid binge drinking and saving up your units to have all at once, as this can be dangerous whilst taking warfarin and can increase the risk of bleeding. If you do drink more alcohol than is recommended, you should make a note of it in your warfarin record book. You should avoid becoming pregnant whilst on warfarin. If you think you might be pregnant, make an urgent appointment to see your doctor. If you wish to become pregnant, speak to your doctor for advice, as other anticoagulant medicines are available. If you have any questions about your warfarin treatment, ask your doctor or nurse at your warfarin clinic, or speak to your community pharmacist.